Uh, Hello everyone. My name is Munira. I'm a counseling psychologist and I have my own practice called Out of the Box. I have done my master's in counseling psychology and I have a decade of experience in working in the mental health field. So telling you a little bit about myself, I have worked in different areas of counseling, but my expertise is in working with special needs. Why I love special needs is basically because I have a sense of compassion and drive to help individuals with special needs, especially those on the spectrum. The meaningful work I get to do every day inspires me. Working with individuals with special needs, of course, brings with it a host of unique challenges and opportunities. The individuals I work with make every day fulfilling, and I know that my work is making a positive impact and helping each individual to grow, gain skills, and work towards independence. It has enabled me to see the world through a different set of eyes. I, of course, thank Autism Connect for giving me this opportunity, this platform to share my knowledge and my experiences with all of you. I'm very grateful. They are doing wonderful work by connecting professionals and parents, which is the need of the hour. Um, so, coming to the topic of today that I have taken up, the topic of discussion, it is effective management and finding out effective strategies to manage aggressive behavior shown by individuals on the spectrum. So, I have divided my topic into five parts. That is, one is definition of aggressive behavior. Second is why does this occur? Third, certain do's and don'ts when this kind of behavior is seen. Fourth, the strategies and techniques to be used when this behavior occurs. And fifth is whom to approach for professional help and what kind of therapy works. So coming to the first part, that is, what is this aggressive behavior? What is physically aggressive behavior? What is the meaning of it? And how is it seen in individuals with autism? So, social and communication difficulties are among the most characteristic symptoms of autism spectrum disorder. They are also among the most underlying aspects that can lead to anxiety and frustration that can easily trigger rage in people with autism. So, while neurotypical people, are able to communicate verbally and non-verbally, individuals with autism are often trapped in situations where they cannot make themselves understood. This is what is behind most forms of the deep frustration and anxiety that can suddenly lead to a meltdown and other forms of aggressive behavior. So ultimately, it comes down to the difficulty that these individuals have communicating their thoughts and needs. Very early on in their lives, these kids may learn that, punching, yelling, throwing, breaking objects, scratching their skin, biting, or pulling their hair is the only way to make themselves heard. And of course, many parents who have a child who is on the autism spectrum can relate to these concerns, and they can relate to that being concerned over their child's challenging behaviors, especially when those behaviors are hurtful towards others or to the child themselves. Of course, this is an unpleasant experience for the child, for the parents, and for anyone who has experienced it. And again, coming back to the individual themselves who's showing this behavior, who's showing this aggression, for them, this type of behavior can be frightening, exhausting, confusing, and stressful. The behavior can also lead the individual to miss out on the chance to learn valuable life skills and alternative behaviors. Aggression, if it isn't addressed in an effective and helpful manner, it can lead to more such behavior in the future and it can worsen the situation. I hope I have made myself clear about like what is the meaning of this aggressive behavior and what do you mean by physical aggression and meltdowns. So then we come to the second part, that why does this aggression occur in the first place? What is the reason behind it? When we are attempting to change any individual's behavior, it is helpful to understand why they are behaving in a certain way. Exploring the cause of the behavior will have a more positive difference and will help to manage the behavior more effectively. Many things can trigger aggressive behaviors, but common reasons are they're feeling very anxious or stressed. They're trying to communicate and they're having difficulty in communicating their wants and needs, as we discussed before. Then they're in some kind of physical pain. They're seeking attention, or there is a sensory overload or oversensitivity, or they could not be understanding what's going on around them. For example, what other people are communicating, verbally and non-verbally. So, all in all, there are four functions of this behavior. First is to escape. That is, the individual is exhibiting this behavior to get out of something or to avoid doing something. So let's take an example that this individual is throwing food and dishes across the table or on the floor because they don't want to sit at the dining table and eat their meal. Second could be getting attention, and it could be getting negative kind of attention also. So like for example, the child is hitting his mother because he wants his mother to play with him and she's not giving him enough attention because she's busy being doing her housework. Third is access. That is, they behave a certain way because they want to get something, or like for example, maybe it could be a toy, a video game, a food object, etc. And so, let's take an example here. That a child may be hitting another child because he wants the toy that the other child is playing with and cannot wait, right? And the fourth is automatic reinforcement. That is, they understand and they learn that when they behave in this particular way, when they behave aggressively, it is because of that they will get something automatically, or it will help them to manage their sensory input. So, for example, a child may be pinching the mother's arm often because he likes the sensation of squeezing her skin. So these are the four main reasons, but another very important reason to consider is medical issues. So we have to understand that whether the aggressive behavior is being elicited or is getting increased because of the medical issues. So there could be some kind of illness such as an ear infection, a headache, a fever, or have some ongoing medical conditions such as diabetes, because of which they're engaging in aggressive behaviors. And because of these illnesses, they're uncomfortable, they are in pain, and they're not able to express this pain. And this is especially true for individuals who have difficulty with the spoken language, who cannot communicate well. And another important thing that you need to consider is their basic needs. So when the individual is tired, hungry, uncomfortable, they may engage in more aggressive behavior than otherwise. So I would suggest that there are certain questions that you need to consider as a parent or a caregiver to understand about this aggressive behavior. Like for example, do they have a regular sleep schedule? Do they struggle staying asleep? Do they have a routine for meals and snacks? Do they eat a well balanced diet? Do they seem to get stressed or overwhelmed when either they're too hot or too cold, or because they're wearing certain textured clothing? So, answers to these questions is very critical and very important when, especially, you're trying to manage aggressive behavior. Uh, Coming to the next part, that is why, what can you do when you see this kind of aggressive behavior? Like, what are the do's and don'ts when such behavior occurs? It's a very overwhelming, very anxiety provoking situation. It gets very difficult. So, what can you do then and there at your home or when you're out with somewhere? So, let's understand this first, that when we push and force the individual to calm down and stop those behaviors, especially one prone to anxiety and rigidity, their natural instinct is to dig their heels and hold on tighter. When we force them to face their fears and not behave aggressively, and I mean screaming on the floor petrified, we aren't helping them. So, like, let's take an example. If I was forced into a room full of spiders, I would probably be able to detach from my brain at some point to cope after about 40 hours of screaming. But here I can't say that I've had some kind of breakthrough or I've successfully been able to face my fear. And also somewhere I will be storing these traumas, and they would be invariably triggered later on in life, and it will be affecting in the long term. So when you are talking about forcing these individuals to behave in a particular way or to face their fears, it ranges on a spectrum that is ranging from just encouraging a hesitant individual, which is okay. Sometimes it's fine to just encourage if they're a little bit hesitant, to then actually physically forcing them into a scenario that has their brain screaming danger. So when we let them get comfortable and calm at their own pace, and then they finally take their step of their own wish and accord, that is when we're actually going to be able to help them in terms of managing these behaviors, and then they will be okay. So, as a parent, caregiver, we want them to fit in. And sometimes also we're just too tired and to be patient and empathetic, but force isn't the way to achieve calm. When they have a meltdown, parents often want to stop the tears because it is very hurtful to them. It is hurting their hearts that their kid is struggling, or because they are running low on patience and they just want peace and quiet. But crying, wailing, or flailing is not a way that your child wants to get back at you somehow or is just taking some kind of revenge. Is there just that their bodies require it at that moment of time to release the tension and emotion from feeling overwhelmed with all these different emotions and sensory stimulations. Their brains are wired differently, and so it's how they interact with the world. And this is something we need to come to terms with, we need to accept in order to support them in the best way possible. So I would say the first thing is that you need to be empathetic. Empathy means listening and acknowledging their struggle without being judgmental. Expressing emotions in a healthy way is a very good thing, whether it could be playing, through tears, through journaling, and it is a good way of venting out your emotions. So, our job is to gently guide them and give them the tools to express themselves in a way that doesn't hurt their body or hurt other people. So, when we empathize with them and validate their experience, they feel heard. And everyone wants to feel heard, especially a person who frequently feels misunderstood. So, empathy is at the heart of all the steps in dealing with aggression. So, when we are looking at their behavior as a form of communication, it helps us view that they are struggling and they're not being defined. We need to remove this word defiance out of our vocabulary entirely, and we need to replace it with empathy and compassion. And by showing them compassion, we can more effectively support them. Also, I have seen in my practice and in my experience that parents at times say that when their child or the individual is behaving aggressively, they tell them that go to a secluded space and don't come out from there till the time you don't stop that behavior. Now, this kind of message, like, is not appropriate because they don't deserve it. Tells them basically that they don't deserve to be around people that love them, that when they're having a hard time. And of course, this is not our intention. This is not what we intend to say through our message. So we need to be there for them by staying close, by being near them. They need to feel safe and loved. And sometimes these individuals on the spectrum are so lost in their emotions that they can't hear us. In these situations, all we need to do is just remain calm and quiet, and we need to be by their side. And also, I've seen parents, at that time, because the situation is so anxiety provoking and everybody's panicking, that they just want to try to talk to the individual and get them out of this panic situation. But this is just a waste of breath, because nothing is going to work at that moment of time immediately, to get them out of that aggressive behavior. So during this process, refrain from speaking to them, like, scolding them or asking them to stop or making eye contact with them or reacting physically, like, by flinching or making faces. You know, don't show your exaggerated movements. Don't talk in a loud voice. There should be no changes in your facial expression. And because these kind of reactions actually validate that behavior and make the situation even worse. And during that outburst, they are going to be feeling very stressed. It's hard to process anything what anybody is saying or doing when you're feeling stressed, right? So, this is especially true for individuals on the spectrum who can have trouble understanding language. So, please do not say too much. If you want to be helpful, try not to say too much during that situation. Aim for short phrases or even just a couple of words. Like, for example, you can just say, sit down, or rather than come here and sit down. Another thing, again, as I'm emphasizing, that you need to remain calm. Remember that this behavior can be kindled if you give in to their aggression. So, this is the first and most important thing, that managing your own feelings and staying calm and quiet so that you don't add your emotions to that entire mix. And just stay calm, follow the behavior plan, and reinforce appropriate behavior. If the situation is too much out of control, prevent them from making contact with you. Of course, if they're harming themselves too much or they're harming you too much, you need to get out of the way, and you also need to move other people out of the way by keeping them prepared and teaching them how to do it. So one of the best ways to do this is simply telling them to leave the room immediately. Because if they are in a room full of people where others are also present, it could actually aggravate the aggressive behavior. So having them go away for a while is actually helpful at those moments of time. Also, you need to protect your vulnerable parts of your body. So you need to ensure your safety and other people's safety. Also, you need to be ensuring their safety or the individual's safety. So you need to ensure that whichever room they are in, there are no shelves or glass objects which can break and can hurt them or harm them. So enclosed space, a quiet space option. um, Another thing that I've commonly seen is that when these individuals behave aggressively, a common thing that some parents and caregivers want to get into, or they unintentionally do, is giving punishments. Now, punishments can make these individuals feel shame, anxiety, fear, and resentment. They can't control this behavior. They're not doing it purposely, or it's not a way of getting back at you. So they shouldn't be punished for this behavior. Instead, they should be allowed the space and freedom to cry loudly and feel safe and loved, with someone being there, letting them know that they are supported. Another very important thing is that I've seen parents asking me if they can use physical restraint. So when you have to use a physical restraint, if you think it's very, very essential, please speak with your pediatrician or behavioral therapist about it, about what other options you can use. Because physical restraint can be dangerous both to you and to the individual, and it can often increase the anxiety and make the situation worse. So, positive behavior support is always preferable to physical options. Then, another important thing is that calmly redirect them to a different method of communication. So, for example, if they're usually hitting you to get your attention, you can instead instruct them to tap you on the arm and say, can you please help me, or excuse me, or help me? Visual cues can help in these situations. So, for example, you might have a picture of a quiet place in your home where they can go to. Teach them coping strategies only when they are calm. There isn't much we can do during the phase when they're having that aggressive outburst, but when they are calm, you can teach them coping tools, and it can definitely work on emotional regulation. So, for example, some individuals respond well to nature walks, some respond well to yoga, some respond well to meditation and deep breathing, and there are many other such strategies. So, these coping strategies will help them calm down, perhaps even some before an aggressive outburst takes place the next time, and when even when you're not around. Uh, Again, I keep telling parents another important thing is that please keep a sensory toolkit handy with you. uh, Sometimes keeping a few sensory tools or toys in your car or in your house or in your bag can offer them, and by offering them this when they're having an aggressive outburst, can actually calm them down and keep them at in a more relaxed space when their mind is feeling overwhelmed. Of course, every individual on the spectrum, they have different favorites, but some common sensory tools are, weighted lap pads, noise cancelling headphones, sunglasses, fidget toys. And again, do not force these on the individual, but if they choose to use them, these products can often be very helpful to calm them down. So, for example, the noise cancelling headphones are very simple and easy things to use, and they help with noise sensitivity. Dimming the lights or switching off the lights can, actually work on light sensitivity. Then ensuring that you're not you're avoiding certain strong smells or certain using certain strong cleaning chemicals can actually reduce aggressive behaviors which are linked to smell and sensitivities. So, like, during the mealtime, do not bring out anything that has a strong odor that might trigger the aggression. So, this is that. And then you also give them only direct acknowledgement, that is eye contact, etc., only when they engage in the appropriate behavior. Failing to do so will actually lead them to think that they will associate the aggressiveness with getting attention and getting what they want. So try not to give in to the aggressive behavior at that moment. And if you continue to give in, they will continue acting aggressively, and because they will have learned that pattern. So typically, the function of the behavior will tell you what might reinforce the behavior. So, for instance, if the function of the behavior is to get an electronic device, then the individual will, behave aggressively when they want that particular device. And if you give in to that, it will reinforce that aggressive behavior because they learn that if I behave aggressively, I will get that electronic device. Another example is, so how can you resolve this? So, for example, if a child is hitting his sibling because they want a toy, so behavior that you could teach instead is that instead of hitting, say, can I have a turn? Or learn how to wait for your turn. So, when you see these positive behaviors, that is the time you praise the child and you reinforce these appropriate behaviors. Again, a very, very important thing that I need to tell before we move on to the next subtopic is that you need parents and caregivers. You need to give yourself a break from time to time. Parenting, caregiving can be exhausting no matter where you are, who you are, especially when you are working or you have a child, on the spectrum or an individual on the spectrum. It is very challenging because they exhibit a lot of challenging behaviors. So it can be really emotionally tiring and emotionally draining. So I suggest that find a support system, plan times that you can have time away, find other people who can care for them, and also give you a break sometimes. Now, coming to the next part is that yes, till now we understood what is aggressive behavior, what could be the possible causes, what could you do and not do when this aggressive behavior occurs at that moment. But we also need to know that how do you stop them altogether? How do you reduce them? How do you prevent them, right? When you're managing an aggressive behavior, the best and first recommendation is to prevent it, right? So, what we call this as neutral redirection. It's an effective way to stop the individual from hitting. This technique consists of replacing an aggressive behavior with functional, appropriate behavior. So, with some guidance and gentleness, neutral redirection allows to effectively teach socially appropriate and safe behaviors. And these skills are very important to interact with peers, share experiences, and enjoy a higher quality of life. So now let us first understand the term antecedent. Antecedent means before. So using antecedent strategies means to do something before they act aggressively. Now take a moment to think about how you might be able to reduce the chances of them acting aggressively. Some ideas to consider for antecedent strategies include not missing nap time. If the individual acts more aggressively when they're tired, providing strict rules about access to preferred items, such as an electronic device. If they tend to act aggressively when they especially want that device, then finding alternative ways to satisfy and regulate their sensory experiences, especially if they're behaving aggressively when there's too much of a sensory overload. Then follow a schedule. Plan for quality time with your child. Make a schedule that is ideal for them and your family and is followed consistently. Consistently is the key word here. So that they aren't behaving aggressively because they want your attention. And also help them practice alternative behaviors and functional communication. Functional communication is when the individual uses more appropriate communication skills. So, what you can do in this situation is that if you want to reduce and prevent these behaviors, first thing you need to do is by looking at what's triggering the behavior and what is the individual getting out of it. Working this out would help you to manage it. So, try keeping a diary of the behavior for 1 or 2 weeks, noting what happens before and after the behavior. Understanding how well they can communicate is also a key important point to find out what's causing the aggressive behavior. It can be helpful to ask yourself that is the individual trying to tell me something? For example, if they don't like conflicts, but they can't tell you, so they might just hit you instead of as a way of saying, take it away, I don't want it, right? Or, for example, if they find it hard to switch from one activity to another, they might bang their head on the floor. But so when you tell them that it's time to put away something before dinner, so what you could do here is you could try telling them 5 minutes before that you need things packed away by showing them a photo of washing hands and sitting at the table for dinner. This will give them a signal plus time to finish up and pack away. Another thing is that, like, if they're supposing the individual has been doing a puzzle for 10 minutes and they start to pull their hair, they might be trying to tell you that they want to do something else. So, offering them a new activity might stop the hair pulling. Or they might hit themselves because they want you to look and talk to them. Giving them attention will stop the self hitting. And the next step is teaching them to get your attention in other way. For example, by saying mom or coming to you and showing you a help card. Another thing reason could be that they might be feeling frustrated and need help. So, for example, a child is playing with a doll and the leg comes off. So they start to scream and scratch themselves. If you help them fix the doll, it will stop the self-injurious behavior. But the next step is to teach them to show frustration in another way. So, for example, to either show it through a sign or again by showing you a picture for us that which indicates that they need help. Another very important point that I want to tell parents and caregivers is that you need to give up some control over the environment or your routines by also offering choices. Providing choice will also teach the individual independent thinking and problem solving, which are again very critical and important life skills. You can use visual support like a picture board or a photo to help provide clear expectations for each activity or different parts of the day. Prompt and model the behavior that you want to see instead of the aggressive behavior. Praise the behavior when you see it so that it will continue being part of their routine. Remember, if you like something, you need to let them know. Catch them being good, and that will actually benefit you and the individual. So, giving them what they want can strengthen the behavior and make it more likely that they will behave in a similar way in the future. So, all in all, a better long term strategy, if I sum it up, is prevent the behavior by avoiding the situations that can trigger it, teach them to express their needs in a more positive way, sometimes also learn to ignore this behavior and reward them when they express things in a more positive way. Now, coming to the last subtopic of my discussion. So, now we understood that what can you do to prevent this behavior or reduce it as a parent, a caregiver, a person who looks after or is dealing with or working with an individual on the spectrum. But sometimes it does not work, and sometimes things get a little too difficult. So, an experienced professional like a psychologist, by using functional behavior assessment and functional analysis, can help you understand and manage your child's aggressive or self injurious behavior. This might be particularly helpful if you have already tried other strategies and nothing has been working. While short term tactics work to control acute violent episodes, it's essential to get the root triggers of the violence. So, a psychologist can help to identify the triggers and help you develop approaches to lessen the instances of such behaviors. Of course, the results won't happen immediately, it will take time, but it will definitely be positive over a period of time. Now, the task of the psychologist is to identify the intended communication behind the behavior. For example, is the individual expressing dislike of what the caregiver is doing? Are they trying to communicate that the task given to them is too difficult? Do they want something that they cannot have? So understanding all of this is the key to building the path for more appropriate ways in which they can communicate their needs and wants. And once a psychologist understands why the individual with autism is behaving aggressively, we can work towards prevention and treatment. Then the psychologist will create a positive behavior support plan, which includes strategies to reduce the behavior and teach new behavior. This plan will help to identify and outline specific strategies that are likely to be effective for the individual. And each individual is different, as we all know that every individual on the spectrum is different. So an individualized approach to managing aggressive behavior is necessary. Now, some of the components of a behavior plan are to understand the function of the aggressive behavior, understand the operational definition of the behavior, ascertain the proactive and reactive strategies, and ascertain the replacement behavior. So here the professional, the psychologist will understand about the individual's aggressive behavior, including looking at how often they strike, whom or what they strike, that is objects, themselves, their siblings, their parents. These details are very important. And even what exactly they do, like slapping, biting, punching, scratching, etc. Other factors to be assessed or which will be identified are what is the individual's age, the number of times this behavior occurs, the settings of the behavior, and how strong it is. It is critically important to understand the exact sequences that lead up to the aggressive behavior. And a very important point is that the tactics to control the aggressive behavior in a 2-year-old toddler is going to be very different from that which is given for a 15-year-old teen. So it is important to determine, and another important thing is it's important to determine when the aggression does not take place. So if the individual is consistently calm and they get something what they want and allowed to be in a safe space for as long as they want to be, then this will give important details as to when the violent behavior can be curbed or even stopped and in what way. These details need to be developed with an eye on the long term, and the solution is not as simple as letting the individual do or giving them whatever they want. The plan which is made by the psychologist will help the psychologist and the other caregivers determine what situation is most likely to trigger the aggression, what methods work to alleviate it, and what situations are least likely to lead to an outburst. The goal with this tactic is to move away from being reactive to problem behaviors and instead look for ways that the problem behaviors can be prevented. When the plan is discussed, it is about all the constructive and positive activities that don't lead to aggressive reactions. So these activities then can be increased. And similarly, when it becomes clear which activities lead to hostile responses, those activities will be decreased. Sometimes, yes, it's also important that sometimes the preferred activities also need to be curbed. Because, for example, individual cannot be given a tablet all day long, a tablet device all day long. So even if that is really what they want, and if it elicits hostile reactions when they're not given it. So as more desirable activities are increased, the reinforcement for not acting aggressively should also be increased. And over time and with care, these reinforcements are slowly paced out and they're phased out as a way of normalizing non-aggressive behavior. This way, even when the individual has to give up that tablet device, they are more amenable to productive ways of expressing their frustration or disappointment. Uh, Before I end, I would just like to say that, meltdowns and aggressive behaviors shown by these individuals could just be a problem which is seen on the surface. There could be a core issue or a deeper problem that may need to be addressed urgently, which is causing discomfort in order to reduce the aggressive behavior. Then in such situations, it's very important to identify these problems and work on them first with the help of experts in the respective areas. I hope whatever I discussed today, you all found it helpful. I hope my topic of discussion was something everyone found interesting and you all are able to take away something from this and could be helpful in your respective lives. I would just like to end my talk on a very positive note, saying that, facing this or any issue or challenge is not the end of the world. It's okay to feel overwhelmed, worried, disappointed, concerned when these kind of behaviors are seen or any kind of problems are seen. But it's equally important to have a positive, solution focused approach. It is necessary to accept, understand, and work on any concern faced and follow the course of resolving any problem in a step by step manner. Please don't feel alone in this journey. This is for all the parents and caregivers. Help is always available. It's only a matter of reaching out. You have groups like Autism Connect. You have so many professionals working here. You can be connected to so many parents. And finding such kind of support systems is very helpful. Networking with the right people and professionals is going to be very helpful in helping you to face these challenges and problems. Thank you very much. In case if there are any questions or comments, I would like to answer them. Okay, everyone. Thank you very much. Have a great week ahead and thank you for listening to me.